Hello friends, warm greetings from TNVAKADEMI. Today in this session, we are going to discuss about ISO 21998-2020, Interpreting Services for Healthcare Industry. So let's begin our discussion. ISO 21998-2020 specifies requirements and recommendations for healthcare interpreting service in spoken and signed communication. It is applicable to all situations requiring healthcare interpreting where the parties involved need to communicate using spoken or sign language in the context of healthcare related issues. It is applicable to all situations requiring healthcare interpreting where the parties involved need to communicate using spoken sign language in the context of health related issues. The standard is intended for interpreting service providers (ISPs) and individual healthcare interpreters who can generally use it as a source of information and benchmark for best practice. In particular, the standard specifies requirements for competences and qualifications of healthcare interpreters and other factors directly affecting the quality and delivery of these services. It also sets requirements and provides recommendations on core processes, training, technical, ethical as well as other aspects of healthcare interpreting services. Interpreting service providers (ISPs) can also certify in order to demonstrate their conformity to this ISO standard. From the practical and certification point of view, fulfillment of all the requirements set out in ISO 21998 allows the healthcare ISP to demonstrate conformity of their services to this document and their capability to maintain a level of quality in healthcare interpreting services that will meet clients' and other applicable specifications. Healthcare interpreting is also often referred to as medical interpreting. Restrictions in the application of this standard are as follows. The first one is, the standard does not apply to translate services. The second one is, the standard clearly states that it is intended for both institutional ISP as well as individual healthcare interpreters, but the certification of individuals is a complex process governed by different regulations and rules. So certification of individuals under this standard may not be possible at this time. As stated in the introduction to ISO 21998, the reasoning behind the document is that healthcare interpreting services enable safe communication mainly between healthcare providers and patients and provide linguistic access to healthcare services. ISO 21998 was developed in response to a worldwide growing demand to accommodate the interpreting needs of patients accessing healthcare services and healthcare professionals, such as physicians, nurses, and healthcare administrative staff, as well as to promote patients' safety, well-being, and dignity during instructions related to the provision of healthcare-related services. ISO 21998 was developed in response to a worldwide growing demand to accommodate the interpreting needs of patients accessing healthcare services and healthcare professionals such as physicians, nurses, and healthcare administrative staff, as well as to promote patients' safety, well-being, and dignity during instructions related to the provision of healthcare-related services. In those countries that do not have any recognized healthcare interpreting education in place, this standard can serve as a guideline and basis for setting up a suitable legal, administrative and educational system for all healthcare interpreting stakeholders. The standard clearly states why healthcare interpreting is distinct from medical healthcare related translation. Translation involves the rendering of various forms of content into another language is written from, recurring a process and the allocation of a certain period of time for the task. Interpreting involves rendering spoken or signed messages from one language to another, either face-to-face or via distance interpreting. Some healthcare interpreters are qualified to provide medical translation while others are not. Likewise, some medical translators may or may not be qualified to provide healthcare interpreting services, as these activities require different skill sets. When documents are not translated, healthcare interpreter sites translate the document into the other language. The standard specifies that healthcare interpreting normally takes place between 3 or more participants. The first one is speakers or signers of a language other than the language of healthcare providers speaks or signs. The second one is healthcare providers or staff. Third one is healthcare interpreter. Healthcare organizations procure interpreting services directly or via an interpreting service provider ISP. Healthcare interpreters who come into healthcare organization to interpret for a particular case, whether face-to-face or via distance interpreting, limit themselves to engaging in the communicative events that require their services. Healthcare interpreters who work in an interpreter services department within a healthcare organization perform tasks and take on responsibilities beyond the act of interpreting in communicative events. These tasks can be related to bridging the cultural and linguistic gaps of the healthcare community, can involve intercultural inquiry, cultural and linguistic education of other healthcare staff, contacting patients, written translations, or addressing matters related to the administration and quality assurance of the interpreting department in question, or comply with patients' safety responsibilities as required by their employer. Healthcare interpreters follow standards of practice, see relevant codes of ethics. Apart from listing specific requirements and recommendations, ISO 21998 also aims to promote market transparency in the field of healthcare interpreting, to provide information and clarification for users and healthcare interpreting services, to establish professional working conditions for healthcare interpreters. So let us now discuss about the healthcare interpreted competencies. Under ISO 21998, Section 4, healthcare interpreters are required to have the following competencies. The first one is patient safety competence. Second one is linguistic proficiency competence. Third one is intercultural competence. The fourth one is interpersonal competence. Fifth one is technical competence. Sixth one is competence in health-related terminological research. Seventh one is healthcare-related competence. Eighth one is communicative competence. Ninth one is interpreting competence. And the last one is entrepreneurial competence. So we have now come to the conclusion of this session. In case you have any questions regarding the topic which we have discussed today, then please put them in the comment section of the video and we will be really happy answering them. Till we meet next, special resource from TNV. Thank you.